Did you know that a number of health conditions can be detected early by your eye doctor? Hi, I'm Amy Reimann of the Cupertino television production, The Better Part. Today I have two colleagues with me, Francis Joseph and Blaine Halley, to meet with Dr. Henry Rodgin, an optometrist for 35 years, to find out why it is so important for people to have a regular eye exam. Blaine, how many people do you know go see an eye doctor for a regular eye exam?
Not too many, only those that need reading glasses or those preparing to pass the driver's test eye exam.
Right. Do you know that an eye exam can be more than just testing for your eyesight?
Yes, it can actually detect conditions like diabetes years before you show signs of the disease.
Great. Why don't we go in to meet Dr. Rajen to find out more about it and ask him to walk us through all those tests. Morning, Dr. Rajen.
Good morning. Nice to meet you.
Will you tell us a little bit about yourself and the Optovision?
Sure, of course. My name is Dr. Henry Rodgin, and Optovision is our office here, and I've been here in private practice for 35 years. And I did my training back in New York at the New York College of Optometry, and then I came out here and I did postgraduate studies up at Berkeley, and that was in the treatment and management of ocular disease. And then I worked up by Stanford for a year, and I decided it's time to open up my own office, and came back down here in 1984, and have been here ever since.
Dr. Rodgin, it seems like they do more eye exams when you go to get glasses these days. Why is that?
Well, the main reason is not just to check the health of the eye for diseases of the eye, such as cataracts, the clouding of the lens, or glaucoma problems in the back of the eye, or what you may have heard of called macular degeneration in the back of the eye. But it's also to check one of the most three common things that we're seeing a huge increase of now in our society, and that is high blood pressure, diabetes, and high cholesterol. And we're able to evaluate, monitor, diagnose, and make recommendations for these diseases based upon evaluating the back of the eye. Because the blood vessels in the back of the eye are so small, that's when we can see initial changes for these diseases and be proactive. And later on in the video, I will demonstrate and show you what type of changes we can see in a normal eye versus an eye that has problems.
I would like to find out what are the different types of eye exam.
Of course, we can show you the different tests we do, how we evaluate it, and what we use that information for to make our final recommendations. So if you want to come into the exam room, I can guide you through the process very briefly that we use when a new patient would come in.
That's great.
Sure, come on in. Actually, the most important part of an eye exam begins right here in this chair with the patient, and that's the patient's history. A lot of doctors don't take time to listen to the patient's actual problems, and at the end of the exam, even though they may have done a thorough exam, they haven't answered the patient's questions. So listening to the patient will direct what tests we do and how we evaluate it. So in general, we go through several steps for a basic eye exam. The first thing is we check the vision far away first, and we have a little eye chart here. We put it up, and we have the patient read letters out there. We do the same thing up close also, and now because everybody looks at laptops and iPhones and iPads, we usually will use a digital machine to check the patient's acuity up close. That's the first step.
That's great.
And then the next thing we do is we will check the patient's color vision, and more commonly seen in men, but we will go through a little book and check the patient's color vision. The next thing we do is we use this little instrument here, and this instrument here is for depth perception, but what we're really checking is the connection between the eyes and the brain to make sure that all the connections are working intact. People who have strokes, aneurysms, tumors, bad things will not pass that test, and we got to figure out why. The next thing we do is we have the patient look at an object, usually a pen, and we will check the motilities of the eye to make sure the eyes don't go in, out, up, down, and that they're balanced and looking at the same place at the same time. And if they're not, once again, we make further recommendations or correct for that imbalance with glasses. Then we move on to here. This test, we have the patient look at this little grid right here. And of course it is a grid. But people with macular degeneration or swelling in the back of the eye, instead of seeing straight lines, they'll see wavy lines, or some boxes will look big, some boxes will look small. Very simple way to assess subjectively the back of the eye. The next instrument we use is over here. And if you want to come around over here, I can show you. It's a little crowded, but come over here. So this instrument here does several things. This instrument here checks the diameter of the patient's pupil. It checks the distance between their eyes, the curvature of their eye, and it also objectively checks their prescription. So it does the work of many instruments in one. The objective measurement of a person's prescription is important, especially for kids or people that can't communicate very well. With that said, this is just a starting point. So despite all this high technology, the next thing we do, which I'm sure you will all recognize, is we use this old instrument here called a phoropter, just a bunch of lenses. Why would we do this if we have all this high-tech instrumentation? Because that just tells us optically what's going on, but what the patient thinks, what's going on behind their eye, in their brain, processing is what we make our final determination of prescription on. And then once again, we will check their vision up close, and once again, we will use usually a digital instrument because people looking at iPhones and laptops, so we'll use this little instrument here. And the same thing, it has a little visual chart, and we will check the acuity in the eye. The next thing we do is, this is called a slit lamp. And this is basically just a high-tech microscope. And the reason we use this is we want to examine the structures in the front of the eye. And the structures in the front of the eye include the cornea, and that's what we do laser surgery on and check to see if a patient's wearing contact lenses, so we check that. We also look at the pupil, the iris, the colored part of the eye, and we look for cataracts, which is this clouding in the lens that's inside the eye. The next thing we do is we want to take a careful look at the back of the eye, the retina. And as I mentioned before, because these blood vessels are small, this is how we notice changes in a patient's general health. So if you look over here, I'll give you an example. So if we look over here, on your left, this is a normal eye. And this is the optic nerve that takes the information and sends it to the brain. Nice color, nice symmetrical borders. All the blood vessels, these are veins, these are arteries, everything is open, everything looks good. On the right, this is a person that has very bad hypertension and diabetes. And the problem with diabetes and hypertension is you get these blood vessel leakages, these little hemorrhages, and that's what causes the pathology in your eyes and your feet and your kidneys. And these little things here are called exudates. That also comes from high cholesterol. One other thing that we look at too is, if you've heard of macular degeneration, this is an example of macular degeneration. And it's this area here. And this you want to detect early because, although there's some treatments, early detection is the key to saving a person's vision. So we will evaluate the back of the eye using this instrument. Next, we move on over to here. This instrument checks the pressure in the eye. Some people remember this as that horrible puff of air test, but yes, this is what we do. And we check the pressure in the eye for what's called glaucoma. And glaucoma is when the fluid in the eye doesn't drain out as quickly as it's being produced. So the pressure builds up and it damages the optic nerve and blood vessels. And we want to know what the pressure is in the eye, so we use this instrument to actually flatten the eye for just a second, and that tells us what the pressure is on the inside coming out. The last thing, or next to last thing we do is this. This checks the field of vision, and patients will look at a central target, and when they see little dots flickering, they will press the button. So we do this to check the sensitivity of the eye, and also to notice if there's any blind spots or deficits in the vision, and then of course with the R, we've got to figure out why they are. The last thing is we have the patient come sit here and we do a final assessment. And that's where we make recommendations to the patient, tell them what we've come up with, then we give them options for treatment. And as I will discuss in a minute, options are divided into two categories, optical and medical. So if it's medical and they need antibiotics for an infection, steroids for inflammation, a medicine for allergies, referral for surgery, that's when we'll discuss the medical part. If it's optical, it comes down to three options, which are contact lenses, of course, which go on the front of the eye, eyeglasses, and I'll show you outside options we have with that, and LASIK surgery. LASIK surgery is when we change the shape of the front of the eye, the cornea, and that just corrects distance vision. Some people think it means you won't need reading glasses, but in fact, we all need reading glasses as we get older. But that's another great option for a lot of our patients is LASIK surgery. And I can show you outside with glasses some of the options that we have available for our patients there.
Wow, I've never seen most of these instruments. Are these tests part of a regular annual checkup? Or?
Exactly. So a comprehensive eye exam is just that. It's comprehensive. So we do literally all of these tests. Not always do we do the photographs. Sometimes we'll actually just look in the back of the eye with a little instrument over here, and that's called an ophthalmoscope, and it's right back here. The nice thing about photographing the eye is no drops. We don't have to dilate the patient. They can drive, so it's very convenient for them. But no, we go through everything here to a comprehensive evaluation of the eye, all those tests.
Oh, so not just when someone has a complaint or
Exactly.
symptoms.
And I'm sure yourself, and you also, how often do you go see your dentist?
Every 6 months.
Every 6 months, and you?
4 times a year.
4 times a year. That's interesting. Most people don't do annual eye exams, but yet if you had a cavity, is it fixable? Yes, they can fill it. You need a root canal, is that fixable? Yes. You lose your tooth, can you replace it? Absolutely. An implant, a bridge, etc. When you lose your vision to glaucoma, a macular degeneration, it's over. There is no replacement. And your vision is the most number one sense you have to connect you to reality in the world. And if you lose your vision, nothing else matters, because that's how we perceive, that's how we react, etc. So when we insist on people getting annual exams, it's not just to check for those vision problems, which a lot of times, unfortunately, are not correctable, but sometimes preventable. It's also, as I mentioned before, to check the health of the eye. Diabetes, which we're seeing a huge increase in, high blood pressure, high cholesterol, basically the American diet, lack of exercise, etc. Luckily, we are making some progress in that direction, have a long way to go.
Dr. Rajen, what are the different options that people have in correcting their vision?
Well, assuming, as I mentioned before, it's not a medical problem, which of course we would use medication for or surgery, and it's an optical problem, we either do LASIK, as I mentioned before, or contact lenses. With contact lenses, we tend to do a disposable lens, simply because the patient has a clean, fresh lens in there. It's great for sports. If they lose it or rip it, it doesn't matter. So that's what we do for contact lenses, and contact lenses also slow down the progression of nearsightedness. So a lot of parents are concerned about that with teenagers, where every year the prescriptions gets a little bit worse. And then, of course, there's glasses. And glasses, there's many options in terms of size, shape, and color. But there's also many differences in terms of the options that go into the lens. Most commonly, what we recommend too is we always give our patients anti-glare coating. And what anti-glare coating does, it does two things. It helps with oncoming headlights with glare. It helps with reflections off of the computer screen. And if I was to take a picture of you, you wouldn't see those funny reflections either. Other options we do are thin lenses. And there are two different types of those, what we call high index and polycarbonate. Polycarbonate are the ones that we use for kids, because they're actually impact resistant lenses. They're thinner and lighter, and they block out UV light. If people have a very high prescription, we'll use a very high index lens, because that'll give them the minimum thickness on the edge and look better cosmetically. Another thing some people enjoy is the ones that change color. Those are called transitions, and they stay light on the inside and they get dark on the outside. When you come inside, they take a few minutes to lighten up, but it's a very convenient option. Other times people just get separate glasses and separate sunglasses, or they also make glasses over here that have these little clip-ons. So some patients don't want two pairs, they don't want to wait for them to get light on the inside or dark on the outside. So these clip-ons go on top of the glasses, and they are what we call Polaroids. And what Polaroids do is they eliminate glare. So when people get glare from horizontal surfaces like the hood of a car or water and things like that, it will eliminate glare. The one thing about Polaroids though, it's hard to see the phone because usually the phone is polarized, the display.
Oh, I see.
So we go over these different options, make recommendations, and then find out about the patient's lifestyle. Are they doing water sports? Are they driving for a living? Are they staring at the computer all day? And that'll guide us into which option is best for them.
Thank you, Dr. Rajen. You have provided us with many good information that we didn't even know before.
Thank you for being with us. We hope you have gained some valuable knowledge from our show.
Taking good care of your eyes and preserving your vision for life is extremely important. Be sure to schedule a regular eye exam for early detection and treatment before they become a problem. Until next time, take care and thank you for watching.